Have you ever wondered what actually happens when you undergo anesthesia? Do you feel anything? Do you dream? Or can you wake up during surgery? Today, I'm going to break down the entire anesthesia process, what happens before, during, and after surgery, and answer some of the most common questions people have. I am an anesthesiologist. My job is to ensure that patients are comfortable, pain free, and most importantly, safe during surgery. Anesthesia is one of the most fascinating yet misunderstood fields of medicine. So, if you are ever curious to know about how it works, this video is for you. Make sure to stick around until the end, where I answer some of the common myths and concerns about anesthesia. So, once you are scheduled for the surgery, the anesthesia conducts what is called pre anesthesia assessment or pre anesthesia checkup, or simply PAC. This is where we check your medical history, your allergies, previous surgeries, any medications that you are taking. We also assess your heart, lungs, and other vital functions to ensure that anesthesia is safe for you. And then we order some investigations. You might also be given fasting instructions, which is typically about 6 to 8 hours before surgery. However, we allow you to take clear liquids like tender coconut water or clear fruit juice, which is pulp free, up to 2 hours before surgery. This is important because anesthesia relaxes your body, including your stomach muscles. And if there is any food in your stomach, there's a small risk that it could come back to your mouth in supine position, that is sleeping position, and then it enters the lungs, which can be dangerous. And then we also discuss different anesthesia options with you, whether general anesthesia, regional anesthesia, or local anesthesia, whichever is best suited for you for your particular surgery. Once all these things are done, we shift you to the operation theater and start induction. So, are you curious to know about how you actually fall asleep? Once you're on the operation table, we connect all the monitors that are required for your monitoring, and then we insert an IV cannula in your hand. It may be either of your hands. Through this, we inject medications that make you fall asleep within seconds. And the most common medication used is propofol, which is very beautiful in the sense that it acts very quickly and gives you smooth and pleasant induction. Sometimes, if we choose not to give you IV induction, we may use a mask which is filled with anesthesia gas, which is often pleasant smelling, which you breathe in and out as you drift off to sleep. Once you are asleep, we may consider inserting a breathing tube or endotracheal tube, or simply hold a mask over your face to help you breathe during your surgery. Don't worry, you won't feel anything at all. Then comes the phase of maintenance, where the surgery is done. You are unconscious, yet the anesthesia team closely monitors you, your every heartbeat, your blood pressure levels at regular intervals, your oxygen levels, your breathing, your brain activity, to make sure that you are safe. We also adjust your anesthesia levels continuously to make sure that you remain completely asleep and pain free throughout the procedure, yet not overdosed. Anesthesia is not just about keeping you asleep, it's about balancing multiple factors like pain control, muscle relaxation, stability of vital signs. And you should know that different surgeries require different anesthesia approaches. For example, if you are scheduled for a simple surgery of your foot, then we might just give you spinal anesthesia instead of full general anesthesia. After the surgery is complete, you enter a phase called emergence. where we slowly reduce your anesthesia medications, allow your body to wake up naturally. Some people, however, might wake up feeling a little groggy or dizzy or cold because of the AC that we use, which is completely normal. You may feel a little bit nauseous or may actually vomit, but we manage this with simple medications. Most people do not remember the moment they wake up. It feels like 1 second you were walking into the OR and the next minute you are in the recovery room. Once you are stable, we move you out to the recovery area where the nurses keep a close watch on you, monitor your vital signs, and ensure that you are completely awake and comfortable. Next, I want to address the common myths and questions that you may get about anesthesia. One thing people may ask is, can I wake up during surgery? Yes, this is a very common fear, but with modern monitoring and carefully controlled anesthesia, the risk is really minimal, which is about less than 0.1% in general anesthesia cases. Will I feel pain during surgery? No, absolutely not. Once you're under anesthesia, your brain is completely in a different state. You won't hear, you won't feel, you don't remember anything. Post-operative pain is an entire different thing that is managed with the medications, either intravenous or oral medication, to make sure that you are comfortable. The next question is anesthesia dangerous? For most healthy individuals, anesthesia is very safe. The serious complications are really rare. The risk is much lower than what you think. However, if you have complex medical issues like uncontrolled diabetes, if you are an elderly person, if you have suffered a heart attack, then we may take extra precautions to minimize the risks. I hope this video is helpful. You have understood the basics of anesthesia. But do tell me, have you ever undergone surgery under anesthesia, and do you remember anything at all of the surgery and anesthesia? Comment in the comment section.